Ethionamide, also known as Trecator, is a medication used in combination with other drugs to treat tuberculosis. It is an antibiotic that works by stopping the growth of bacteria. It is important to note that ethionamide only treats bacterial infections and will not work for viral infections like the common cold or flu. It is essential to take this medication only as prescribed by your doctor, and using it when not needed can cause it to not work for future infections. The daily dosage and the optimal timing for taking this medication should be determined by your healthcare provider based on your specific medical condition. When taking Trecator, it's important to follow your doctor's instructions. You may take this medication with or without food, usually once daily. If you experience stomach upset or nausea, consider taking Trecator with meals. Your doctor may also suggest dividing your daily dose into smaller doses to be taken throughout the day. The dosage will depend on your age, weight, medical condition, and how you respond to treatment. For the best results, take this antibiotic at regular intervals. Try to take it at the same time every day to help you remember. It's important to continue taking Trecator, as well as any other TB medications, until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early or skipping doses may cause the infection to return and make it more difficult to treat. Your doctor may also recommend taking vitamin B6, pyridoxine, to help prevent certain side effects from ethionamide, the active ingredient in Trecator. If your condition persists or worsens, be sure to inform your doctor. Some common side effects of Trecator may include nausea, vomiting, diarrhea, stomach pain, increased saliva, metallic taste in the mouth, loss of appetite, or sores in the mouth. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. While many people using this medication may experience serious side effects, it has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of side effects. Your doctor will carefully monitor you to reduce your risk. Contact your doctor immediately if you experience serious side effects such as persistent nausea/vomiting, unusual hunger, excessive sweating, shakiness, extreme fatigue/weakness, yellowing of the eyes/skin, dark urine, joint pain/swelling, slow heartbeat, changes in mental state, changes in vision, eye pain, numbness/tingling of the arms or legs. A serious allergic reaction to Trecator is rare, but seek medical help right away if you notice symptoms such as persistent fever, new or worsening lymph node swelling, rash, itching/swelling of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a complete list of potential side effects. If you experience any other effects not mentioned here, contact your doctor or pharmacist. For people in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking Trecator, it's important to talk to your doctor or pharmacist if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Before using Trecator, make sure to tell your doctor or pharmacist about your medical history, especially if you have liver disease, kidney disease, underactive thyroid, or eye problems. Avoid alcoholic beverages while using Trecator, as alcohol may increase the risk of liver disease or mental/mood changes. Trecator may also cause live bacterial vaccines to not work well, so be sure to tell your healthcare professional that you are using Trecator before having any immunizations or vaccinations. If you have diabetes, Trecator may lower your blood sugar, so it's important to check your blood sugar regularly and share the results with your doctor. Be sure to tell your doctor if you have symptoms of low blood sugar, and they may need to adjust your diabetes medication, exercise program, or diet. If you are pregnant or plan to become pregnant, it's important to talk to your doctor right away about the risks and benefits of using Trecator. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. When taking Trecator, it's important to be aware of potential drug interactions. This means that Trecator may interact with other medications you are taking, which could alter how they work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without the approval of your doctor. This will help ensure the safe and effective use of Trecator. As always, follow your healthcare provider's instructions and ask any questions you may have about taking this medication. If someone has taken too much Trecator and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Now, let's talk about the uses of Trecator. This medication is used to treat tuberculosis. It is usually taken 2 to 4 times daily, with or without food. It's important to take it at the same times each day. Follow your doctor's instructions carefully. Taking Trecator at the best time each day can help maintain a consistent level of the medication in your body and maximize its benefits. Always consult your doctor regarding the proper dosage and timing of Trecator. It is important not to share Trecator with others. Your doctor may require you to undergo various lab and medical tests while taking this medication, such as sputum tests, eye and vision exams, liver and thyroid function tests, blood glucose tests, and complete blood counts. Make sure to attend all your medical and lab appointments, and consult your doctor for more details. Remember to take each dose of Trecator at the scheduled time. If you happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose. Don't take a double dose to make up for the missed one. It's important to store Trecator at room temperature, away from light and moisture. Avoid keeping it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of Trecator, it's crucial not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, it's best to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Trecator. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.